Hi, my name is Chris Herlihy. I'm an occupational therapist working for the Calgary Early Supported Discharge team working in stroke and brain injury. This presentation is going to review the best practice for managing attention impairments after a stroke. Canadian stroke best practice informs us that about 60% of people after a stroke have difficulties with cognition that can affect our day-to-day function and our safety. One aspect of cognition that can cause quite a difficulty is our ability to pay attention. Rehabilitation of cognition and specifically attention impairments is an important part of our recovery after a stroke. This presentation will provide education and some strategies to support your attention impairment. I'll also go over some treatment activities that will help optimize your functioning at home. So what is attention? Attention is what forms the base of our cognitive function. When issues arise in our attention, it can also affect other areas of our thinking, our learning, and our memory. No matter the nature of the task, attention is always required. It's what's used to pick out the things that we need to attend to and block out all those things that we don't need to attend to. Attention is broken down into 4 areas. The first being sustained attention, and this is our ability to pay attention or concentrate for a prolonged period of time. Some examples of this might be reading a magazine, watching TV, talking on the telephone, or listening to music. The next is selective attention. This is the ability to focus our attention on a task while filtering out the internal and external distractions. Example of this is like focusing on a conversation when you're in a loud coffee shop, or maybe it's reading in front of the TV and blocking out that information. Third is divided attention. This is the ability to pay attention to 2 or more things at the same time. Some examples of this might be talking on the telephone while you're making your lunch. Maybe it's taking notes while you're listening in a meeting. Or finally, maybe it's walking down the street, you're about to cross a road and you're talking with a friend. Finally, there's alternating attention. This is the ability to fluctuate back and forth between 2 things at the same time. An example of alternating attention might be you making your dinner, you stop to answer the door or the telephone or help one of your children, and then you return to the cooking task exactly where you left off. At times, clients can recognize attention difficulties, and some common statements that we hear are, "I'm easily distracted, I have difficulty concentrating, I miss details or make mistakes often. If I get distracted, I have trouble picking up where I left off. I'm slow to respond. I have a hard time focusing when there's noise in the background." Some of the strategies that can help support these attention difficulties are reducing the auditory and visual distractions. This may be done by turning off the TV or music in the background, or maybe you choose to put in a set of earplugs to block out that information. You could turn away from a busy environment or go to a room on your own. You could also reduce the clutter in the environment. This will help reduce the visual information that's being presented to you at once. Managing your fatigue is also a simple strategy. We know when we're tired, concentrating and paying attention becomes a lot harder. There's a potential for increased errors, especially if you're already dealing with an attention problem after a stroke. You want to understand and be aware of your limitation of how much energy you have. You want to plan to do cognitively demanding tasks in the morning when you're fresh and you have more energy. And you want to think about the task and how much time it will take before fatigue sets in. With that in mind, you want to plan for rest breaks throughout the task and throughout your day. You want to try and avoid crowds. Plan to go to the grocery store in non-peak hours. And if you must go in a crowded situation, plan ahead and use some strategies to support your attention. Some examples might be creating a shopping list to reduce the cognitive fatigue by having to remember the items. Or maybe you plan just to go for less of a time period, okay? Spend less time in that busy environment. You could use environmental cues. It's a great strategy. This might be setting an alarm or using sticky notes to help remind you to return to the task if you get distracted. And then there's double checking your work. This will help improve success and give an opportunity to find potential errors and give you an understanding of the types of errors that you're making. If needed, have someone sit beside you and check the work with you, or if you don't feel confident, have them check it for you. And be sure to be extra diligent when double-checking tasks that are quite cognitively demanding. This may be something like doing your finances, or maybe it's a work-related activity that is quite important and you don't want to make mistakes. Because attention is such a key skill that ultimately impacts all other aspects of our cognition and our thinking, You want to focus on attention retraining, as this can help improve a variety of memory and thinking skills and have a positive overall effect on your cognitive function. Some treatment activities that can be completed at home to focus on attention retraining might be completing a math equations worksheet where all the math equations have different operations. Putting a list of words into alphabetical order, and that could be your favorite hockey players, or maybe it's ingredients in a familiar recipe. Maybe it's counting backwards or forwards by a specific variable. Completing a cancellation task is always a good one. This refers to maybe going to a book and reading through it and picking out a specific word on the page and canceling it out. Maybe it's finding a letter on the page and crossing out all that letter. Maybe it's cooking a familiar recipe with the radio on in the background to cause some distraction. Or you could also work on the computer and slowly increase your time in front of the screen. Looking for specific items in a grocery store is a good functional task. Watching the news or listening to a podcast and reporting back the main headlines to a family member. Or maybe it's watching or listening to a TED Talk and taking notes at the same time. All these tasks can assist with improving your attention and have some focus on retraining. You want to be aware that you want to work on the attention area that is specific to your needs, as this is going to help for better success and more improvements with your own attention. To further challenge your attention, you want to think about grading the activities, as this is going to help you progress forwards. This can be achieved in a few ways, gradually increasing the complexity of the activity, and this can be done by increasing the length of time that you're spending, or maybe it's increasing the difficulty of the task. Increasing the auditory, visual, and environmental distractions is going to help work on your attention as well. By simply working on improving your speed and timing how long it takes you to do the task, and then trying to beat that time the next time you do it. Cognitive rehabilitation is a significant component of stroke rehabilitation. Daily practice working on attention strategies and tasks will help build a good foundation and help improve your cognition over time. Remember these three things with regards to attention. Reduce your distractions, slow down and take your time, and review your work. This concludes the presentation on attention impairments after stroke. If you have any questions or concerns, please reach out to your family doctor or local healthcare center. You can also check out the best practice links listed on this page. Thank you for listening.